All right, we'll get this one started. Today's Zoom is for those who may be curious about Medicare Advantage. Medicare Advantage is privatized Medicare. That's the simplest answer. We're going to go about the pros and cons, Medicare Supplement versus Medicare Advantage, who likes which side. It is not that one is good, one is bad. They are different. If you love chocolate, vanilla ice cream doesn't cut it, right? It's not that it's a bad flavor, just not what you're looking for. So we will go through that. If you have any questions, please put those in the chat and we'll be watching that to make sure that all the questions get answered. I cannot see you. Not even sure if you see me, but we have this screen deck to kind of go from. I'm going to keep everybody on mute until we get into kind of a question and answer thing towards the end. Okay. All right. So Medicare Advantage is privatized Medicare. Also, kill me now with the alphabet thing the government came up with. The guaranteed best job security for an insurance agent is the ABC stuff. D for drugs is the only piece that made sense. Y Advantage is Part C. No say. I can't answer that one, but it is. So they use the terms interchangeably. Medicare Advantage versus MedSup. In comparing these, it just means weighing one, you have costs that are going to increase every year as you get older. One, you don't. One, you get your little deductible and then it pays 100%. Maybe some of you have the old Plan F where it paid 100%. On the Med Advantage, you have copays, but the premiums, huge difference between the two. So there are advantages and disadvantages to each. You will never, ever in your lifetime have both at the same time. If you have a Medicare Advantage plan and you think you're being smart by also having a Medicare supplement, you're not. Let me silence that. You are not, because that is just going to waste. Your Medicare supplement supplements Medicare. If you have Medicare Advantage, you told Medicare from the government, bye-bye, don't want you. I want privatized Medicare. So a lot of times if people transition, they forget to go back and cancel their supplement. Who likes what? There's pros and cons. So on the Medicare supplement side, you have unrestricted provider choice. You can go to any doctor or hospital in the United States that accepts Medicare. And, ooh, here's the hard part, is accepting new patients. That's a problem in our area, is that we have only one clinic in Capitola that is accepting new Medicare patients. So some people are going to the Medicare Advantage plan just to get a primary care doctor. That's Santa Cruz County. If you live elsewhere, the story would be different. You have predictable costs. You pay your premiums, and then that covers nearly all of your medical. You have automatic coverage. As soon as Medicare approves the surgery, the scan, the lab work, whatever it was, the Medicare supplement or gap plan automatically pays its share without any need for referrals or prior authorizations. They are trying prior authorizations in a couple of states, thankfully not California. It also is for my Medicare vagabonds who live in RVs, travel extensively. Rolling Stone gathers no moss people. It's a lot easier to travel in and out of the US with Medicare and a supplement. I'll tell you some stories about how those can work. On the con side, the premiums start much higher and they get higher every year. This year, on top of congratulations, you're a year older increase, we had double-digit rate increases from all of our carriers, anywhere from 10 to 15%. So that trend, I don't see stopping anytime soon. So just know sometimes that what was really good when you first turned 65, now if you're 80 and your supplement is $300-400 and the Advantage plans are 60, that might require a financial conversation. So, on the con side too, you're dealing with having Medicare a supplement and a drug plan, three different things, three different payments, three things to track. So if you did not get a Medicare supplement when you first turned 65 or when you first got your Medicare Part B, if you retired later, then you may not have guaranteed issue into that. We do have a group of people in Santa Cruz County this year who were with the Dignity Health doctors and were on an Advantage plan with Aetna. Aetna has pulled all of their plans out of Santa Cruz County. So those people get the golden ticket, Willy Wonka golden letter that says you can go have anything you want. And, they have to give it to you. So there's always workarounds for this part. Who likes Medicare Advantage? Also, again, kill me now, Part C. It has the lower monthly premiums. Oh, and by the way, if you're trying to scribble notes, um, pull out your cell phone and take a picture of the screen. It'll save you a lot of writing and you'll actually be able to read what that is. Let me make it a little bit bigger for you too. There you go. So these are lower monthly premiums. There are some areas that have zero premium plans, Santa Cruz County not being one of them. We have plans that start at $59, go up to $77. They can add extra benefits that Medicare does not usually cover, like adding dental, vision, hearing, fitness programs into their plans. They are bundled all in one. So this is the same plan everybody in our county would get if you buy that plan, regardless of where you are. And they all have an out-of-pocket maximum, which is the yearly cap on how much you have to pay, not how much they will pay. So the more popular plan, it has a cap of 4,900. So even if you got into, in and out of the hospital all the time, many surgeries, 4,900 is the worst that could happen to a person that has Medicare approved services through that plan. On the con side, you have a network of doctors, much like the plans you had pre-65, where you had an HMO or PPO and you had to use the doctors in that plan. So that can be what some people think is somewhat limiting. You always will have out-of-network care available to you for emergencies or urgent care. These are managed care plans, so they typically require referrals to see a specialist. Although locally, if you're in with the doctors, let's say at PANF, you email your primary care and go, hey, drop something on my foot, need a podiatrist, and they usually set it up. So it's not nearly as obtrusive as people make it out to be. But those specialists will also be in that plan, right? You need to stay in network. And then they can be interesting to use outside of the area. Like I said, you always have emergency services. Hospitals are great at figuring it out. But I was recently on a trip with someone who had a scrape, thought it was getting infected, wanted to go to urgent care. He has a Advantage plan from Utah, where he is from. And so the urgent care was like, great, we'll see you. We're going to charge you this amount. Then you take it all back and you deal with your Advantage plan on that. So sometimes if they're looking at it and they don't even know the name of that company, you may get an answer, something like that. Oops, I went all the way to the end. Never mind. So this is kind of a side by side. So, and just for grins, I was playing around trying to use Chat GPT, and I told my assistant sent me a picture of her young son watching a Zoom that I was doing. That's what was on the screen. That's her son, cartooned, and my dog trying to teach a guy in our office how to do Medicare. So those are actually dogs hanging out behind me listening to this once again. So again, you always have to have original Medicare A and B, no matter which one of these options that you pick. But if you choose the Advantage plan, that money that you're paying to Medicare is handed over to the insurance company to take care of you. That's why you're only paying a low premium and amount. You can go to any provider that accepts Medicare and new patients. You have a network of doctors you need to work with. In our area, people tend to say, I'm always with Sutter, I'm always with Dignity, or I'm with Kaiser. Kaiser and Sutter have Advantage plans this year. In Santa Cruz County, Dignity Health doctors do not. So the people that are losing those plans have the choice. I can go back to original Medicare and get a supplement, or I can get another Advantage plan that's a great one, but I have to change doctors. It's never a happy conversation, but I get to have it 54 times because that's how many Aetna clients I had. Monthly premiums much higher with the supplement and much lower on the Advantage plan. The Advantage plan has your prescription drug plans built in on most of them. There's a few that don't have a drug plan that are meant for veterans and some other groups. And then there's typically not extra benefits like vision, dental. You can buy them separately with a MedSup, and they're often included in a Medicare Advantage. Um, you know, better travel if you're one of these vagabond folks. You're never in your home district for very long. Advantage plan may not be as fun to work with as a supplement. These are best for people who want flexibility, predictable cost when you have claims. These are for people who want low premiums and a lot of extra benefits, a lot of extra bells and whistles, maybe no deductible. There's some fun things to that as well. Let's see. That's just it in another nutshell. I kind of like the first side-by-side one better. So it's your choice. You can always stay on original Medicare and a drug plan and a supplement or Advantage. Again, never going to have both. So let's see what we got in the chat here. So ask your dentist for the person who wanted to know. So if can you keep your current dentist if you change plans on what you have? Marcia, why don't you elaborate? You're not on mute, so we should be able to hear you.
Okay, can you hear me?
Yeah.
Oh, good. Yeah, I'm thinking about changing to the Medicare Advantage. And
Okay.
that's okay, so I'm wondering, I really
So
like,
the Medicare Advantage in Santa Cruz County
uh-huh.
is alignment and it works with the Sutter Health doctors. Do you have Sutter Health doctors?
Yes.
Okay.
Yes, I do.
All right. So I will tell you that the dental in that plan is only works at one dentist. So unless you're with Dr. Habib, I think is the only one in the county that actually takes it. No, the dental that's built into that plan would not do you any good. It's also not costing you anything. But if you wanted something that works with your dentist,
Mm-hmm.
the conversation has to go. Use these exact words. Ask your dentist's office, are you a network provider for any of the individual dental plans?
Network
Notice
provider.
I did not say, do you take? They'll all take it. Network provider means I'm going to give you a discount. The real value in dental insurance is if your dentist is a network and
Right.
provider and they're giving you a discount. Otherwise, put 50 bucks in a jar, pay cash. That's what I do. My dentist isn't a network provider for any of it. So
Okay. So are you a network provider for
any individual dental plans.
individual? Okay.
Because a lot of times they'll tell you, no, MetLife, Cigna, right? They're not selling individual plans. And it's not enough to say Delta. Delta has an HMO, a PPO, and Delta Premier. Those are three different levels. So think like we think about cars, um, Ford,
Mm-hmm.
pickup, Mustang, Pinto, right?
Yeah.
So, those words that we use are super important. A lot of people get some pretty crazy answers because of the way they ask the question, or because, like in this situation, if you ask the question, can I continue with my dentist? well, then it's like, who's your dentist? What plan are you on? Which plan are you talking about, right? So there's not enough in the way a lot of people structure their sentences to be able to answer it. But all right, does anybody else have any questions?
I
No,
have one
Pamela.
more.
Oh,
Okay,
go ahead, Marcia. Go ahead.
Oh, that's fine. I'm late. You go.
okay.
Yeah,
I can't see any of you, so one person pick.
I'll go. This is Paul Jensen, Pam.
Okay.
And so I've got Medicare A and B,
Mm-hmm.
and then my EDP, which was Anthem Blue Cross, has no
Is
longer
gone away. So
has
you'll
gone
have
away.
to replace the drug plan at a minimum.
Right. So my question to you is, how do I go around shopping for a replacement to my Anthem Blue Cross MediBlue RX Plus PDP? Where do I?
Okay, so that is a different Zoom that I did, but let me show you where you went to.
I'm in Santa Clara County. I'm in Los Gatos.
I know, but the answer is the same no matter who. So let me go here. I'm going to go to my website. And this is where you guys went to find the Zoom link, right? That for this that you're on. These that are saying that it's about Medicare.gov, that's what you're going to want. But I do have here's how to use Medicare.gov, how to find a drug plan. So these videos are recording of the Zooms that I've already done. So I would definitely watch them. But in a nutshell, you're going to hopefully have created a username and password to log in. If you haven't, do so. But if you just log in, I'm going to just pick one that I happen to have. I think that's login. Oh God, I remembered it. Shocking. So anyway, this, if you log in, you have what's my plans? Oh, look, here it all is, right? Check my claims. There's so many things you can do in here. I lost my card. If you, tap around, you'll find a place to replace the card. But up here, shop for health and drug plans. So this person already has this plan, and next year their plan will turn into this, so they can look at the details. And if you get extra help or you want to apply for extra help if you're lower income, that's there. Otherwise, you can compare plans. Start looking at all that. You can go in here and put in your drugs, and then it'll show you the cost for your drugs on each of these different plans. And the way that it will sort is to go to, you see, here's the monthly premium this year. Here's what they thought the cost of the drugs would be. So, that's why this person's on this lower cost plan. But if you want to compare, you can look at the drugs with the other ones, explore other plans, right? So now, okay, that's their zip code. I want to look at drug plans. So here's the plan they're on. It's a zero premium and their drugs are still super cheap. Seems like a winner. Probably won't change that. But what you want to look at is the total drug and premium cost. So this is how much I pay in premium plus drugs. That's the number. Don't fixate on just the premium or just the deductible or just the drug cost. It's this number, total drug and premium, that you want to fixate on. And you'll see the next one was only $5, but huge more cost for the drugs. So this person's going to stay right where they are. But that's how you would go and shop the drug plans for yourself
Okay, so I just navigate that on the Medicare
on the
um,
Medicare website. Yeah. That's
website,
the
log
only
in.
software that you guys have access to.
Is that a question to me? I mean,
No, I
I,
said that is the
oh,
only,
Oh, okay.
commercial site that you have access to. When I was working with each of you guys, I used a different product. So I'm used to seeing it in a whole different place in a different way. But let's say, okay, I wanted to, okay, I think that's my next plan. How did they get these drug costs, right? I can look at plan details and it will open up further. And now it will look at the different drugs that got put in. And I put in a bunch of different pharmacies. Well, probably don't want to use CVS because I'll pick one of these that they're preferred. And it will show you the cost of the drugs on each of these different pharmacies. And drugs are, they'll always say estimate. It's like buying groceries. Milk, bread is never the same price. We don't really notice it so much on those. But if you were paying $40.60 and your pharmacist tells you another number, we all freak out. So know that the prices of drugs change.
Okay, because I'm currently using CVS with
Well,
my,
with whatever, again, this is looking different for you, right? So when it says pick some pharmacies, that's why I say throw in a few of them, CVS, Safeway, Walgreens, whatever's local to you. And just note if there's a price difference.
okay.
So this is not your information, so these are not your answers. There is no normal. There is no way somebody, and this is the email I never want to see from any of you. Hi, my name is Susan. Does my plan cover this? No last name, and it's Hello Kitty 54 or something for, don't have the slightest. My first inclination is to delete. Sometimes I restrain myself and answer Susan who. But you realize I can tell you absolutely nothing with that, right? But if I get it, hey, it's Susan Smith, and I'm currently on WellCare Values script. I don't have any medications next year. Do you think that's a good plan? It's a good plan, but the other one is cheaper, right? Now I can give you an answer. Boom, didn't require any research, didn't have to be on my computer. I could be out playing with my dogs, which is frequent, and it still answer your question. So cut our staff a break on those. It's really hard to answer. All right, Advantage plans. Is there a yearly maximum? Yes, they're different on each of the plans. The main one I work with is 4,900. I think Kaiser's is 62 or 64. So they're all different, but yes, they all have a maximum. And if you travel, um, there is no travel supplement unless you go out of the country. There's international plans I could help you with. But if you're traveling, like the example I gave you where we went to Hawaii, you're still in the United States, even though it took you 4 hours from here to get there. But it is, it might be that you have to pay for it if it's urgent care. I had somebody who they were upset, their Advantage plan didn't cover it. They had a very mild flu. They went to urgent care. They who told them, hey, you have a mild flu, just go, lay up, drink some 7-Up, whatever. And so their Advantage plan did not cover it because it did not get coded as urgent or emergency. If you're in a car accident, do not worry one bit about where that ambulance takes you. Clearly, that was an emergency, right? So the worst case scenario, if it's one of those questionable things, a lot of the plans have telehealth. You can call up a doctor for $0. And if it's something basic like, does this look like poison oak? Can you send me some, hook me up with some cream, that sort of thing? They can take care of that all over the phone. If it is something like that mild flu and they would have called that, they probably would have told them, okay, stay home, lay up, do whatever unless you feel these symptoms, then go to urgent care.
Hi,
What? Okay, who's this?
this is Sandy Dewick.
Okay.
I have a question for you, professionally speaking.
Mhm.
What is your opinion of the Advantage plan? Can you
They're
say?
good for people, my clients who are on them, because I screened who goes there and we've had this conversation, love them. I've only out of probably 100, 170 or so of the people in Santa Cruz County that I've put on, let's say, that alignment plan.
Mhm.
They were super, and actually my clients that had Aetna, they were happy with it. It's just going away. So now they're not happy with it. But, you know, if my parents would be an example of somebody who'd be really happy with it. They don't go anywhere. They don't do anything. And my mother is an obedient kind of patient. Her daughter is not. Um, and so if her doctor said you should go over and get this blood work or go see this specialist or go do this, she would obediently do it.
Mhm.
My mother's a classic person of who would be very happy with an Advantage plan. You know, I have clients who are trying to hit some of these recordings and they're currently traveling across the United States in a van that they converted. It's their big, you know, gypsy vacation. Maybe it's not the best plan for that person, right? Because
Okay.
their chances of needing prescriptions, things on the road are going to be greater than what my parents will experience.
Okay.
So it's not you know, for me, I'm the Rolling Stone. First of all, I'm on the young side for Medicare, right? And so my Medicare supplements are still reasonable when I have people who are 75, 80, 90 years old, and
Mhm.
now their med sups are $300, $400. They're rethinking maybe now I'm going to go to Medicare Advantage because for $59, if I want to do something that's a little outside the network, I'd have cash to pay for that. So there's if it's something that you want to look into, these are things that I can still do one-on-one appointments for. I cannot for the drugs because we're kicked to the curb. There's some I couldn't even write you an application if I wanted to. They've so far suppressed what they want to do. We only have 10 plans left standing in the state of California. Anthem canceled all of their plans. That tells you how toxic the environment is on drugs right now. With that Inflation Reduction Act putting in that cap at 2000, companies bled, right? When they bleed, they're coming after you either by dropping the plan, this is not an area we want to play in anymore, or ratcheting up the rate or closing down the formulary so there's less drugs covered, whatever that might be. So politically, that's a hot button that is not going to change for a while.
Okay, thank you very much.
Yeah. Any other questions?
I I wrote one on in the chat. I just want to know if I decide to go with Advantage this year and realize that it's really not what I need, can I go back?
Have you ever had an Advantage plan in any time in your life?
No.
Then yes, in 1 year you can. You get a trial period. So that's a great question.
Okay.
And then like the Aetna people, I think part of your comment was they seem to disappear. Disappearing is actually your friend. You don't want them to stay and be toxic. You want them to go away because then you get that letter that all my Aetna people got that says your plan's no longer offered. Use this as your proof of coverage to get a supplement or another Medicare Advantage plan. And we have had years in Santa Cruz County when we've had no Medicare Advantage plans. So the ones that work with Sutter have been here now and stable at actually the exact same price and the same doctor copays for 5 years. So color me super happy and surprised every year when I see that it's still here. So something that they are doing is working. And Alignment just got a bunch of like US News top awards and that sort of thing in like 5 different states that they work in. California was one of their newer states about 5 years ago. But of the Advantage plans, if I have to work with one of them, I have no love lost calling any of them for you guys. I'd much rather work with that one.
Hmm.
So,
So is there a way to find out if you go to Advantage, what drugs they'll cover?
yep, I can do that when we do it.
Oh, okay.
So, yeah,
So if I decide to do that, then I make an appointment, actual appointment with you.
make an actual appointment. Yes,
Okay.
make sure that when you make the appointment, it's that you're exploring Medicare Advantage. right? Because if you just say drug plan, they're going to tell you no.
Okay.
Because there's 1,700 Medicare clients through our office now. And I can't do 1,700 drug reviews when there is zero income in it, or pay my staff to do it, because then it would cost me $30 an hour plus not making any money. So, but on the Advantage plans, we still get paid. On the supplements, we still get paid. I'm happy to, when people transition into Medicare or have a big life change, help them through that. But I only have time to do that if I don't do the 1,700 drug reviews, which is the unfortunate thing this year. I told people last year it was probably going to be the last year.
Mhm.
Unless something politically greatly changes, neither political party like insurance companies or insurance agents. They see us as a middleman that adds cost. So I'm an equal opportunity hater of both sides. All right. Any other, let's see, is Sutter taking new supplements? No. So if you are not a current patient of Sutter or Dignity Health, they will not take you with Medicare and a supplement. If you are a current patient of them and now you get a supplement, then yes. But if you are not a current patient of that doctor, no. Sutter hasn't for about 5 years. Dignity hasn't for about 3. The only place we have that I can refer people to that I know will take you as a new Medicare patient is the community clinic on Capitola Road. Good questions. Keep them coming.
Oh, Pam,
Uh-huh.
I was a Sutter patient, and when I signed up when I got Medicare,
Mm-hmm.
they canceled me as a patient. I went to use it, and they said you're no longer. It was during COVID, and they
You
said,
have to see them at least once every 2 to 3 years. And so
well,
a lot of people didn't go during COVID.
they didn't tell me that though.
Well, I'm telling you that that's the product.
Okay,
So with Medicare and a supplement, you being a patient of them makes $0, right? If you come and get a service, that's how they get paid. So for those of us who are healthy and don't come, frankly, we're dead weight, right? And
sure.
they will kick you off and get some new blood in there that will help keep the lights on for them.
Well, and also because they don't accept any Medicare, they don't accept the basic Medicare insurance at all anymore. They're
They do. They do, but if you are a existing patient.
well, existing patient.
So I have traditional Medicare and a supplement, and I go to a Sutter doctor. I was a patient of that doctor before I went to Medicare. I made
Gotcha.
sure I had a doctor before I turned 65. So I
Well,
see
then,
them every year and it works just fine.
well, I
But
told them, I said, if you just want me to throw money at you, I'll do it if I can stay a patient. And they said, sorry, you're out.
you were already out.
Yeah. And
So
there's no new patient signups. And so they're
there
basically,
are one doctor in each of the clinics that I can assign who is taking new patients if you're doing the Medicare Advantage plan that works with
well,
them.
sure. The Advantage one is
I
with,
know, but I'm telling you, the answer is a hard 0 on
right.
traditional Medicare and a supplement or just traditional Medicare. They don't care.
Is
They
there a
kick
way of
you to the
using,
curb.
is there a way of using emergency room doctors as a primary care?
It's not a great way. Here's my own personal family story. A couple of years ago, my parents were totally healthy. Mom, apparently, she's already had all the parts that can kill you taken out. So it's not like she sees a doctor on a routine basis for pap, mammogram, that kind of stuff anymore. And she was always healthy. So apparently, in 10 years, she never went and saw her doctor.
Right.
She has a fall, breaks a hip, and now we need a primary care doctor to, deal with all the after hospital stuff. It took me 6 months. My only saving grace was my mother also has memory loss, and so hospice picked her up for a while, and that got us through until I finally convinced a doctor to take her.
Gotcha.
But I mean, I'm telling you, that's a bad place to be. For those of you who have Medicare and a supplement, go see your doctor once at a minimum every 3 years. I don't care if you go see them to say hi and get a flu shot. I don't care. Go. Or they will kick you unceremoniously to the curb.
Okay. Well, that kicking, requirement I was never aware of it, so,
And it's not something they're going to put in the paper.
right.
There is so much all of you will never be aware of, right?
Well,
And even as an agent, we're not aware of it until it starts happening,
right,
right? Because they can make a decision, it's still a free country, and say, I want to run my business this way. And because PAMP did it, then a couple years later, Dignity started doing it too.
right,
And the financial reason why they do it is because if you come in with cash, the money is there right now, and they get paid the full amount of what they want to charge. If they take group health insurance from your employer, they get paid less, but it's still more than Medicare and Medi-Cal at the bottom,
right.
right? So they have to limit. I only need a certain percentage of if I had all my patients be Medi-Cal and Medicare, it would cost more to provide the services than you would ever get in payment. There has to be some of these other people to pay the bill. So Dignity is taking Medicare with supplements if you have existing doctors, if you have seen them, if you are a current patient. So yes, they do turn away new to them Medicare patients, not the hospital. So we think of Dignity as Dominican sometimes. The hospital's not the problem. Primary care doctors and specialists, that's the problem. If you end up in the emergency room and you end up in the cardiac unit at the hospital's not going to not let you in because you have Medicare. They love you. And the nursing, skilled nursing places love that more than they love Medicare Advantage. But the primary care doctors and specialists would prefer an Advantage plan. They get paid a little better.
My, my drug, policy,
Mhm.
Part D was
Mhm.
with, Aetna. And when I signed up, it was $7. And
Mhm.
I just never use it and never have an occasion to it. And then after a couple of
Well,
years,
it's going to be 103 next year, so chip chop, you need to
well,
shop.
well, that's what I mean. It already went up to 60 without even using it. So,
It's
I'll
you
shop
guys
it.
got to realize none of this is about you as an individual. Zero.
Sure.
You are part of this larger conglomerate mass of us older folks, right? And so what happens to one of you happens to all of you.
Well, it's just that they are
The
free to,
political climate changed massively for them.
right.
So there used to be, remember the donut hole? That was gone a couple of years ago. So the pricing and everything had to adapt. If the insurance carrier is on the hook for 100% after $2,000, do you think they're excited? Anthem, largest company we have, right? They're out. United Healthcare, they couldn't smash theirs down to like one plan. Cigna had 3 plans. They changed their name and went down to 2. I mean, there's just like nothing. Never ever for the rest of your life, any of you, can you not shop your drug plan every year or your Advantage plan if that's what you have. I don't care if you
Well, and who's
liked
to
what you
say
had, it won't be the same the
if,
next year, or
if you,
odds are it won't be.
okay, if you
So,
shop it and you say, oh, this, I'm paying 60 now and this one is 10. Oh, I'll
mhm.
go with them. And then in a month, it's up to 140. I mean, it's
Not the plan premium and the plan design only can change on a calendar year basis. And every
okay.
year you have the chance to shop it.
Gotcha. So it's a year you got to go in
It's
and
a year to year,
gotcha.
calendar year. So
Okay,
you
makes
shop
sense.
it now and it will be from January through December. And the
Great.
next fall, you're going to shop again. And maybe it's the one, like in that example, the the plan Edith had is still the best plan for her next year. Great, we shopped it, don't need to do anything.
Great.
But do need to know that last year it was called Cigna and this year it's going to be called HealthSpring. So you don't think, oh, this is junk mail and throw it away. That was your ID card.
There you go.
Right? So you each got a notice of change from your insurance carrier. If you ask for things electronically by email, that's where it is. If you ask for things by mail, that's where it was. And so it's a booklet and it says, here's what your plan looks like, your premium and all your different costs. And here's what it's going to look like the next year. Or in the case of the Aetna folks, your plan is leaving, go shopping, bye.
Yep.
Right?
Well, I love the changing their names and switching the policies. It's like we try to be a moving target for you.
Yeah, well, I mean, that's the exhausting part of doing what I do, right? Is because I know it's going to change. And sometimes to like beat you people to go and do this and send me that paperwork every year, it's exhausting.
Sure.
And on a political level, while I am sad that I can no longer be that resource that I was before, and I have total angst about that, I'm not sad about not doing 1,700 drug reviews. Gotta tell you.
Well,
Unfortunately, the Affordable Care Act is so screwed up right now. Now it's probably good because all of those people, some of them their costs are going up $2,000 a month because they're losing the extra
Yeah.
help that they had. So that I have a different poop hole of stuff I have to deal with. And the group plans and the Sutter Health plan for groups went up 50%.
Ooh.
So the trend is not that anything is going to go down soon. So one of the groups that I think would most benefit from taking a look at Advantage plans is initially when we first went to Medicare and ours, some of you when you started, your top of the line supplement was under $100. And a lot of people I talk to, what supplement are you on and how much do you pay? I don't know. Today is the day you should go figure that out, right? It comes out of your checking account or you pay a bill. The ones that pay a bill every month, no. The ones who put it on auto payment, since we don't get like canceled checks and a statement in the mail anymore and you have to go online, a lot of you don't. But know what that is. You'll get a notice every year that says, happy birthday, we're raising your rate. Congratulations, we're raising our rates to keep up with inflation. Do you guys look at that? So every year, if you have a Medicare supplement, not Advantage plan, when your birthday comes around, call me and we'll look. If you still want a Medicare supplement, is there somebody else who has it for less money? I get people who have been on the set it and forget it for 20 years and they're paying $400 and something a month for these supplements. And then I look and that exact same plan is available someplace else for $100 less. Now these are older folks, but you know, it pays to shop. Maybe it's a change worthy, maybe it's not. At least we looked. Every year you got to shop the drug plan. Every year, if you have Advantage, you shop the Advantage plan. So it will never be set it or forget it. Yes, the recordings will be right where you went to get the Zoom link, and it had that list of all the events down lower. We have to get it from this converted into YouTube, and then we'll get it posted. So it will be there. If you
And-
change to supplement plans, it's about your birthday.
And this, we have to make our decision by when? Is that the December something?
Which
7th?
decision?
Whether we're
if-
gonna go with Medicare Advantage or not?
If you want to switch to Medicare Advantage, it's the now till December 7th.
Okay.
And then that would be for the year 2026.
Right.
And again, if you have never had an Advantage plan before, you've always had traditional Medicare and a supplement, you have a 1-year trial period. So if you try it for 2026 and you go, man, that was too restrictive for me, we can get you a drug plan and move you back to a supplement for 2027. If you have ever had an Advantage plan, that option is not there. The supplement or the Advantage plans are county by county. So I have people who move. If you move out of Santa Cruz and move to Santa Clara, or Santa Clara come to this side of the hill, you're going to be terminated from your Medicare Advantage in that county and be given an opportunity to buy a plan. I've had people move just to get rid of their insurance. Seems a little extreme, but it's been done.
Plan B must be in place no matter what you do.
No matter what, you have to
Right.
pay Medicare their share. It's like the
Right.
IRS. You can't get away from those people. And next year, Medicare is going to be $206.50, not 185. They have not released the IRMA chart yet. So for those of you who have an income adjustment for higher income, you'll be getting a notice in November that tells you what that looks like. It should be similar to what you pay now, but and then let's see what else. Oh, the Part B deductible. A lot of you have the Plan G supplement, and so you pay the Part B deductible. This year it was $257. Next year it's $288. On the drug plan, standard deductible went up to $615, and the highest or the lowest cost plan with no deductible is over $100 now. So you will most likely have a plan with a deductible on the drug side. The Advantage plan that works with Sutter, there is no deductible. So that's a $615 win right there, just on that one column. And then, oh, good. So my assistant put in the website, our website that has the events on it. And there's already a few, there's one like this that I did earlier, so it's already posted there. Medicare will always be available. And the supplements, honestly, is pretty steady, Freddie. We gain more people selling them because they're easy. Life insurance companies can sell a Medicare supplement because Medicare does all the work. And then they just say, okay, I paid my 80%. Here's what 20% looks like. You write a check. So the supplements will always be there. We have had years in the past. We had no Medicare Advantage plans in Santa Cruz County. Then we had an Anthem plan that was a PPO that was like, first it was like $40. Then went down to zero for a couple of years. And then cease and assist, it's leaving. United Healthcare's been here, gone, done that, left. Aetna came here. All the ones that have worked with the Dignity Health doctors are the ones that have left. Not to say that the one from Alignment might not leave someday. Every year I'm super grateful they're still there because I like them. It's the only one of the insurance carriers I purposely bought stock in. But I guess anything is possible. I will not say anything is impossible in health insurance anymore. I've been an agent for 20 years. When I first started as an agent, we didn't have drug plans or Medicare Advantage plans. They hadn't been made up yet. We didn't have Obamacare for sure. So we go through a lot of cycles. So if you only have Part A and B, let me pull this up. I will never recommend this to anybody, but, oh wait, wrong part of the website. I've just gone there so many times. There's a brochure that I probably used with each and every one of you when we first talked about going to Medicare. And it is on here when you go to the Medicare section, more resources. So here is the Medicare brochure that I did. And then here's also some other, documents that you may want to look at. And if you have anybody new to Medicare or you want a refresher about Medicare Sup versus Advantage plan, this video is 20 minutes. It's really good. I would highly recommend coming back here. But the brochure will hopefully look familiar because I use it with everybody. Although the numbers change from year to year. Sorry, when you have Zoom up, changing these takes a while. So this is listing the holes that are in Medicare currently. So if you went into the hospital, you'd have to pay $1,676. We don't know what that number looks like next year. Maybe 1,800, who knows? That's for any hospital stay up to 60 days. If you stay in longer, there's a per day charge. You would be responsible for that if you didn't have a supplement. If you need skilled nursing after the first 20 days after a hospital stay, it's $209 a day, and you only get 100 of those lifetime. You have the Part B deductible that you would have to pay. And then the scarier part is they pay 80%, you pay 20%. There's no cap on those 20%. So 20% of chemotherapy, radiation therapy, dialysis, ET, wow, that would be ugly. 20% of a couple of office visits, no big deal. You probably
Cool.
won't even hit the deductible. So if you're really contemplating I'm just really getting gassed out on my premiums for these plan F and Gs, there is a plan N that doesn't cover excess charges and has a little copay, or there is this high deductible G. I still have 2 companies that offer that. And what this does is says, it kind of puts that out-of-pocket max on it for you. I'll let Medicare be my primary. I'll let it do its thing. And I'll pay those 20% and those deductibles. But if I have a really bad year, I want somebody to come and turn off the flow of my financial bleeding after about $2,800. So at $2,870, you have now met the annual deductible on that high deductible plan, and it would pay 100% like the plan F after that. That's the plan my parents had. They're 88 and 90. Compared to the pricing compared to what the plan F or G would cost, they save about $300 a month each. That more than covers the deductible if they had to pay it. So when they were both in the hospital a year ago, I knew it was $2,800 that I'd be writing the check for. Or a series of checks to add up to that. And I was okay with it because I know what their premium savings is. So if you want to stay on a supplement and you need rate relief, that might be something to take a look at. But again, making a change from a plan F or G down to that is not this annual open enrollment. It's from your birthday to 60 days after that. If you have a high deductible G, it will not be taken away. My parents are on one with Anthem, and Anthem hasn't sold it now for 10 or 15 years, but they still have it. So it will stay. What you can't do is if you have the high deductible G and now you get diagnosed with cancer. Oh, I want to go back and pay that big bucks to not see these bills. You can't go back. No backsies. All right. Any other questions? Got a couple minutes left.
Yes, this is Sandy again.
Okay.
Okay, I'm new to this and it's kind of confusing. Did you?
Guaranteed confusing, just like
Thank
the IRS. Leave it to
Yes.
the government to make something.
Did you
Super.
say that if you already have an Advantage plan, you
Mhm.
don't need to have supplements?
No, you will not ever have a supplement. There are 2 different worlds. There is Medicare with a supplement to be like the pooper scooper that picks up the leftover pieces,
Right.
or big red letter. I couldn't have made this big enough. Advantage plans. The government has sold you at your request to whatever company you have for your
Yeah.
Advantage plan. You do not have Medicare anymore. So you can't supplement Medicare. You don't have it anymore. You have this,
Got it.
right? So it's one or the other, never, ever both.
Okay. And you also said, I think that you cannot go back. Once you have Medicare Advantage, you cannot go back to Medicare.
You have a 1 year, one time in your life trial of 12 months.
Got it. Okay. Okay. Thank you. I get it now.
Okay. It takes a lot to get all the dates and stuff. Honestly, I have cheat sheets all over my wall, so don't feel bad. Because sometimes, especially at the end of the day, when you're on talking to like person number 30, it's just like, oh my God, what was that deductible? Like your brain leaves you, right? So I'm in the same boat with you guys on that one.
Okay. Got it. Thank you so much.
Yeah, no problem. Great questions. Any last questions?
Yes, one more.
Okay.
Why do you have to maintain B if you join the private system on a,
Because the money that you paid into Medicare for
Uh-huh.
A and B, you don't pay for A now, most of us, but you did when you were working.
uh-huh,
So that money, there's a amount for each area. Let's just say that in our area, it's probably around $12,000. The government's like, hey, alignment, Kaiser, whatever Advantage plan you picked. This person wants you, so here's $12,000. Take care of them. Bye.
oh, okay,
So you still have to pay that money, but they in turn behind the scenes are giving the insurance carrier money. And that's why your premiums are $59.77, super inexpensive.
gotcha.
So
So
just
I-
to kind of wrap things up, if you want to explore personally a Medicare Advantage plan and you're not on one now, call the office, tell them you want to have a Medicare Advantage review, right? And we'll go over the plans that are in Santa Clara, Santa Cruz, wherever you are, because they are different. I am not appointed with every company. Kaiser will not work with agents on the Medicare side. So there's no agent that can help you with Kaiser, but I can tell you some basics about it. And if you want to be in Kaiser's system, you can call them. But alignment in SCAN, WellCare, Humana. In Santa Cruz County, we only have alignment in Kaiser. In Santa Clara County, you have lots of options, but the options are that you want. The big thing is doctor network. So start with who has my doctor, and of the ones that have my doctor, which are the best for me. Okay.
Thank you.
All right. So I got another appointment, so I'm going to hop off, but thank you. Thanks for coming on and off mute. You guys are like well practiced at Zoom. I'm very impressed. So, yeah, gold star for that. Otherwise we get echoey, dogs barking, all kinds of stuff. But I will post later today, hopefully, or it might be tomorrow. We got a busy schedule today. The YouTube version of this talk. The one I did before is already there. So go to that website, our website, and the events page where you came to find this. And scroll down further, you'll find some of those recordings. There's one about using Medicare.gov. There's one about just setting up the account. And then there's one here with the question and answers about Medicare in general stuff. And then there's one about Advantage plans. Okay.
Thank you.
All right.
Thank you, Pam.